Today, I'll be working with a client who has been living with complex regional pain syndrome, or CRPS. It's one of the most painful and challenging conditions to manage. In this session, I'm going to be using Reflexology, followed by Reiki, to target specific reflexology points aimed at reducing her pain specifically. You'll see her real-time progress. So throughout the session, I check in with her to monitor how her pain level has changed. So you'll see the session effectiveness as we go and how I get her there. And by the end of the session, we'll do a little testimonial with her to find out where her pain level is at by the end. So I'm just cleansing the feet with witch hazel at this point, preparing her feet for the reflexology session. So I'll take an opportunity here to tell you a little bit about CRPS. It's a chronic condition. It causes severe and persistent pain, and it's often following an injury or trauma. That is the case with this client. She had a dog bite many years ago on her right arm, and it turned into CRPS. It's normal for CRPS to affect one limb or even to spread to other parts of the body. And this condition is thought to result from dysfunction in the nervous system, leading to pain signals that are disproportionate to the original injury. I would definitely say that is how this client experiences CRPS. And it has spread to other parts of her body. So more recently, the CRPS seems to have spread to her right leg. So you're going to notice in this session that I'm working on her right foot much more than the left because she comes for relief, and that's what she always gets. She is a regular client. So we've learned together how to best offer her reflexology so that it gives her what she comes for, which is relief from the pain. So those of you who are my current or past students, you've probably heard me talk about my fussiness with the foot swaddle. So you're going to see that demonstrated here. It didn't go well the first time. She's positioned a little high on the bed to where I normally have her. So the towel position wasn't in a good place to give her a nice tight foot swaddle, but I fixed that by moving the towel back. And I will change the position of the camera at different times during this session to give you better angles. This first angle's not the best, but again, if you are one of our current reflexology students, you'll see this is very familiar. We're just starting with relaxation techniques. Relaxation techniques are very important for CRPS clients as well as other clients, but when we're dealing with nervous system dysfunction, we really want to prioritize getting that nervous system really calm early in the session. I'm going to be doing a lot of extra stimulation of the spine because that's the main highway in the body for the nervous system. So those nerves that go to her arm or go to her leg and all of the other parts and organs of her body, they all pass through the spine. So this spinal stretch technique that I'm doing at this time is especially beneficial for somebody like this client who's dealing with CRPS. So as I continue to do these relaxation techniques, I'm going to share with you a bit about what it can be like to live with CRPS. So you know now that it's a chronic pain condition, but it affects people every day. And it doesn't go away. So this is a chronic condition that often progresses. So mentally and emotionally, that's very stressful. The cumulative stress, not only on the physical body, but on the mind, is really hard for people to deal with emotionally. So for people who are living with CRPS every day, life can be incredibly challenging. It often affects people's ability to maintain employment or even do normal day-to-day functions that most of us take for granted. Something like shoveling the snow or mowing the grass or even mopping the floor or washing the dishes can ruin the rest of a day because it can significantly increase the symptoms of CRPS if those tasks can even be performed at all, which sometimes they can't. The pain can feel constant and intense, and it's often described as burning, stabbing, or throbbing. And it's not just physical pain, it can lead to difficulty sleeping, reduced mobility, and then emotional struggles like anxiety and depression, and even thoughts of suicide. So simple tasks like walking, using the stairs, dressing oneself, or spending time with loved ones can even feel overwhelming. So it's a very debilitating condition. And I think educating reflexologists and people who are living with CRPS about the benefits of reflexology for this condition is going to be beneficial for everyone. So I'm working on the solar plexus point now. You can see I've changed from my standing position to kneeling to better access the point, to be able to give that pressure in an upwards direction. And I'm going to hang out there for a while and come back to it many times through the session because it's such an important point for relaxing the nervous system. This is still part of our relaxation sequence in the By the Moon reflexology session sequence. So I'm doing the zoning now, which is also important in this session. I will come back to zoning again before I'm finished the session, because what you're going to notice as you watch is that I am going to skip a lot of the session sequence. There are going to be many points that I don't specifically work on because this client specifically benefits from so much additional stimulation to the areas that affect her day-to-day life the most. So zoning is a way to give coverage to the whole body briefly, at least. And so I will do it again to kind of make up for skipping some of the other points that are less beneficial in this session. And you'll notice for parts of my session, I like to stand. It allows me to work the feet from different angles, which helps me to increase pressure. I am using a very firm pressure with this client. The first session that she came, she was quite sensitive to my touch, but now that she's a regular, she can tolerate all of the pressure that I can give. And I do find with her that it is the high pressure, high focused pressure that delivers the results that she's coming for. So this is why she's a regular, is because I can deliver that firm pressure. So standing, as I'm doing right now, is one of the ways that helps me to give more pressure, so I'm not dependent just on the muscles in my fingers. I can both push and pull using my body weight as well. But sometimes I like to sit on the ball because it allows me to get lower, which helps me give pressure at different angles than I can when I'm standing. So because her injury and pain affects her left shoulder, arm, and hand, you're going to see me work this area of the foot a lot during this session. So I started with the dorsal shoulder reflex. Now I'm switching to the plantar reflex. Using my knuckle allows me to deliver more pressure to that area. There's significant crunching going on in this plantar side of the shoulder reflex area, and using my knuckle allows me to break up those uric acid crystals a little easier than I could if I used my thumb tip or fingertip. And the neck is a very important reflexology area for any issues from the nervous system, especially when they're affecting the shoulder and the arm. because there are nerves that travel from that highest area of the spine, which is the neck, down into the shoulder and arm. So this is another reflexology area that you'll see me stimulating regularly and with a lot of pressure. You can see the level of pressure I'm offering by the way the foot changes shape. And switching thumbs allows me to give each thumb a break after delivering as much pressure as I am. Now I'm using my fingers to work on the spine reflex area. Again, very important for almost all sessions, but especially those that are affecting the nervous system and causing nerve pain. Sometimes I notice reflexologists skipping areas of the spine, so you really want to make sure that you're starting at the very bottom and going all the way up into that big toe, because your spine does come up into the base of your skull. So we don't want to skip any areas of the spine. Working right on that bony ridge of the inside or the medial side of the foot. I'm still working on the spine. I'm just changing my method. I call this cross-hatching, but I'm just covering the whole spine now horizontally after working on it vertically to give really thorough coverage to that area. And then sweeping it out for relaxation, switching back to the lateral side of her foot, which is the lateral side of her body in zone theory. So we're working now on the hip, thigh, knee, elbow, the arm, the leg. This side of her foot's going to get the most action during this session because all of her pain symptoms are in that side of her body. You can see discoloration on this leg. You'll notice later that it's absent on the other leg. That shows up in this client when her CRPS symptoms are at their worst. Which, when she came in for this session before we started, I did ask her what her pain levels were for that day between 1 and 10. So her pain level in her right arm when she arrived was a 12 out of 10. Her pain level in her right leg, especially in her right knee, was 20 out of 10. So it's rare that she comes in feeling that level of discomfort. I mean, that's off the scale pain by the way she's describing it. The reason that her CRPS is affecting her leg more than her arm is because she has been getting treatments for the arm for some time. So she does also receive medical treatments. One of those is a nerve block. And the nerve block is when they inject a needle into her upper arm and try to get the tip of the needle as close to the affected nerve as possible without touching it, and then bathing the nerve with lidocaine. So this is something that she has regularly, but she can only have it so often. So when she comes in after she's had a successful nerve block in her right arm, that's when I will often give her a reflexology session that focuses even more on the rest of her body. So digestive system, endocrine glands, like the full session sequence. So she gets that benefit as well because her comfort level is much higher when she's had a good nerve block. Not every nerve block is as successful. So her doctor's gotten really good at figuring out how to do a successful nerve block on her specifically, but it is a bit of a chance kind of thing. She's not getting that same treatment in her leg yet, so she has to wait for MRI and other diagnostics to confirm what is pretty obvious by her description, and even her doctors agree, but there is a process in place. So her pain level in her leg, when it's bad, it can be really bad because she doesn't get the same relief from those medical treatments. So I've been continuing to really just focus on that outer part of her body. So shoulder, hip, thigh, knee, elbow, leg, and arm on the right foot specifically. Switching from the dorsal side of the shoulder reflex, going back to the plantar side. By going back and forth, by not staying on one spot for too long, it gives that tissue in her foot a break from the pressure and the touch so it doesn't get overstimulated and uncomfortable. And it also gives my muscles and my tissues a break. So if I rub too long with that knuckle, it starts to burn on me as well. So then I can switch and start using my thumbs, go back to the neck area, and then return back to using my fingers on the dorsal side of the shoulder reflex. Here I'm adding in some lymphatic, working on the upper lymphatics of her body. So I'm using a lighter pressure here because it can be very effective that way. Lymphatic support for clients with CRPS can be especially important because if they experience reduced mobility, it can be really hard for the body to eliminate toxins and waste. So every time we go for a vigorous walk or run on the treadmill or climb stairs or whatever movement is natural for you in the day, or additionally the extra movement you add in if you live a sedentary life, that helps move the lymph in your body. And lymph is a very important system. It doesn't circulate using a muscular pump like blood does. So there's no pump moving the lymph around your body. The movement happens when you move your body. So for our clients who have reduced mobility because of chronic pain or some other disability, lymph support in reflexology is going to be extra beneficial for helping get the wastes out of their body. Reflexology is also excellent for improving circulation. And so the better that our body can circulate the blood as well as lymph, the better that we deliver nutrients to tissues which are necessary for healing and optimal function. So those are some added benefits of reflexology. It's not just about reducing pain, but also about improving the function of the body and making up for some of what is lost because of the conditions that people experience. So we're working on head reflexes now, which are in the toes, because the head is also such an important part of the nervous system. We've got the brain filling a lot of the head, and that's where a lot of the communication obviously originates there, that travels to the parts of the body that tell it to relax or to be stimulated or to give pain relief. That's where the pain signals are interpreted. So we don't want to miss those important head reflexology points. So just working each of the toes, not just on the tip, but the other areas of the toe as well, just to be extra thorough. Soon I'll be checking in with this client to see what her comfort level is, to see how that's changed. And I'll do that throughout the session, but I know that we're coming up to one of those times when I would normally check in so that I can get an area of how much more stimulation is needed for those areas of her body that really affect her. And back to the lymphatics. I love when I'm receiving reflexology, this is a technique that I love. Working on the upper part of the foot that way, it feels so good. And it's nice to be able to offer pleasure, sensations of physical touch that are pleasurable as well. Her sessions aren't very uncomfortable for her. There are points sometimes where she experiences what she calls the good hurt, but there's a lot from the reflexology session that feels really good, which is a nice change for someone who experiences a lot of unpleasant physical sensation in their body. So it can be quite a gift to treat yourself to something enjoyable as well. All right, so we're going to be checking in with her here in a moment. You'll see what that looks like. So I checked with her before going back to the solar plexus for deep relaxation again. Remember that when she came in, her arm pain was 12, and now her arm is 9 out of 10. So it's still really high. Any of us who are living with 9 out of 10 pain probably wouldn't be functioning very well in our day-to-day, but we have seen a reduction. But to me, I would not be happy with a client leaving in 9 out of 10 pain if I could help it. Her leg, though, has gone from a 20 out of 10 to 10 out of 10. So that is a 50% decrease in her pain, which is amazing, but it's still not a comfort level I would be happy with her leaving with. 10 out of 10 pain, just to remind everybody, is usually, kind of the max of what we think we can cope with. So arm down from 12 to 9, leg down from 20 to 10, we still have a long way to go. So I'm going back to that lateral side of the body again, working on her shoulder reflexology point, breaking up some of those uric acid crystals that I can feel as I'm applying pressure. I'll do another comfort level check with her in about 10 minutes, less than 10 minutes. Applying very firm pressure using my thumbs to the neck reflexology area again. Switching thumbs so that I can give even more pressure each time. Working that upper spine, or the whole spine it looks like, right up into the big toe. Don't forget to go right up into the big toe. By holding the foot firmly with the hand that's not currently working, it allows me to deliver more pressure. So it's not obvious that I'm giving pressure with my left hand, but I am. I'm pushing my hands into each other, which helps me to deliver that firm reflexology pressure that is effective for sessions like this. And while we're working on the spine, I'll tell you a little bit about my table setup. It's not really obvious from this angle, but there is a very thick pillow below her knees, which gives her lower back support. It's very comfortable that way. And then I have a flatter pillow under her feet, so there's a soft cushion for her feet to be resting on. You can see her feet sort of sinking into that pillow. There's a memory foam wedge cushion propping her up a little. You can see I'm chatting with her as she's receiving reflexology. I think she gets a lot of emotional support, mental benefit as well from our visits. So some clients, when they come, they like to receive their reflexology session in silence and she is not one of those clients. She likes to talk about things and get some social interaction as well. So the wedge cushion not only is comfortable, but it allows her to be propped up a little bit so that she can see me while I'm doing reflexology on her. I'm using my thumbs on the plantar side of the foot in the area of the kidney and adrenal gland. This is the first time you're seeing me work on these points in this specific session, but they are very important points. Living with chronic pain is very stressful. As you know, it's a nervous system condition, but the pain causes a lot of tension in the body. It disrupts sleep. The condition itself adds tremendous stress to the system. And the more we can induce relaxation with that solar plexus point that you've already seen me working on several times, but now adding in support to the adrenal gland and the kidney reflex points also helps to induce relaxation and provide support to the adrenal gland specifically, which carries the burden of the stress that's experienced every day. And back to the lateral side of the foot, working that whole zone 5 on the plantar side as well as the dorsal side and the lateral side of the foot. On the memory foam wedge that she's propped up on, there's also a nice soft pillow for her head as well. Another thing that you'll notice is I put a small hand-sized towel under her lower legs. It allows me to work up further on her legs without getting oil on the bed linens. Some days she can tolerate that leg massage, and some days it's not so enjoyable, so we'll avoid working on the leg because it can be too much for the CRPS that's affecting that part of her body specifically. I notice sometimes that reflexologists will not pull the sheets or blankets up as high as I have them. So you'll see I got them folded right up over on the knee, which gives me lots of area to work on the feet and lower legs without getting oil on the sheets. And the leg I'm not working on is well covered anyway in the towel swaddle. Working the hip, thigh, knee, elbow again, seeing if we can get that pain level reduced in the leg, especially her knee. And we're just a couple of minutes away now from our next comfort level check. So we'll be seeing, has this extra work on these points reduced her pain any further? Working on the brain points again after the solar plexus push. The order of the work that I'm doing isn't necessarily important. This isn't a session where I would suggest you write down the session sequence. I'm working intuitively. I'm working with this client's specific symptoms in mind. I'm following the comfort level of my hands and switching what I'm doing so that I can continue to deliver firm pressure. So if I get tired doing a specific point, then I will move to another area of the foot, switch the hand that I'm using, or switch the fingers or thumbs. And some sessions she comes in much more comfortable than she did today. So I wouldn't need to work on the arm, leg, knee, shoulder, neck, and that as much as I am on this session. But she came in more uncomfortable than she usually does. Are you curious to know what her comfort level will be when she leaves? Maybe make your guess now. How low do you think I can get her pain level by the end of this session? I think for someone coming in with 12 out of 10 pain or 20 out of 10 pain, you can see she's moving her leg now because I'm asking her and she's checking her comfort level. Even to leave with 5 out of 10 pain would be a significant reduction that would probably be worth coming in for a lot of people. So you can see a bit in the corner, she's moving her arm around now. So she's just testing her comfort level to be able to provide me with the information. So what do you think it is? We're 30 minutes into her reflexology session now. We previously got her pain from a 12 to a 9 in her arm and a 20 to a 10 in her leg. We got the arm down from 12 to 8 now at 30 minutes into her session. So she's still experiencing 8 out of 10 pain in her arm. Do you think we'll get it much lower? Time's going to tell. Her leg has experienced the most amazing, most significant reduction in pain. So the arm was previously 10 out of 10 was what we got it to from 20. And now it is a 6 out of 10. So we went from 20 when she came in out of 10 to 6 out of 10. So we are still making progress, but I'm not satisfied yet. I'm not ready to move on, although I promise I will be working on her other foot before the session is done. I think it's also important for her enjoyment, her experience of reflexology, how she feels in her body, and the nervous system function. But not giving up yet. So more of the same, spine, lateral side of the foot where the hip, arm, leg, shoulder, and knee points are. You'll probably see me going back to the neck and the solar plexus more. What we've been doing has been working, so we're going to continue to do more of the same to see how low we can get these pain numbers. I'm actually really excited for you to see the final results. She was really happy when she left this session, but you'll have to wait and see how she explains the benefit of her reflexology and Reiki session combo. When I'm reaching over the foot like that, again, it's me switching hands so that I can continue to deliver the firm pressure that gets the results that she's looking for. I'm just looking at different ways to stimulate the same points. Here's one of the reasons I don't sit on a chair. So you can see I've moved my body completely over to the side because changing the angle that I'm delivering the pressure changes the pressure. I love being able to move around the feet to both push and pull at points. The whole arm is working. A lot of my pressure comes from my body. If you look at the size of the muscles in that little thumb, and then if you think about instead how much we can deliver if we're delivering it from the muscles in our arms as well, I keep the muscles in my thumb fully engaged so that I can apply pressure from right up in my shoulder, the whole body leaning in. Obviously working within the client's comfort level. So this client is still really relaxed. You can tell because her legs are soft. There's no tension in her legs. She's not pulling away from me. She's not lifting her leg up. Her arms are relaxed. So she's accustomed to this pressure. She enjoys this pressure. And this is the pressure that delivers the results. Here's an example of me pulling a reflexology point. So I'm working on the spine, but because I've moved to the opposite side of the foot from the spine, I can pull to deliver that pressure. And our next comfort level check will be in just a few minutes. But while you're watching me continuing to work on a lot of the same points that have been so effective so far, I will take this time to tell you a little bit about our reflexology training program. So I am obviously a certified reflexologist, and my practice is in Belleville, Ontario, Canada, but I also offer a reflexology training program. I'm part of a training team that delivers in-person classes, but you can also study reflexology online. We use videos, and we have a wonderful manual. There's recorded lectures online, and we have an amazing supportive community as well. And our reflexology training is accredited by the Reflexology Association of Canada. Reflexology is an unregulated modality at this time. Certification gives our alumni a lot of confidence and their clients a lot of confidence in the services that they are delivering. You can make a great living offering something like reflexology to people in your community who experience chronic pain, sleep issues, anxiety and depression, infertility, and other hormonal imbalances. It's a very, very fulfilling career. And so I'll put a link in the description if you'd like to learn more about how our reflexology training program is offered. We have students all over Canada and the US, and we've even trained some reflexologists overseas as well. I'm always happy to chat with potential students one-on-one too. I know that investing in training is a pretty big deal. Many of our students are doing a career change, and so that may be you. You might be working in a less fulfilling profession and feeling that desire to have a little more flexibility in how you schedule your week, or a little more flexibility in your income potential. And it's a big choice, it's a big decision, and I like to help people make informed decisions. So talking one-on-one can be a good way to answer your questions and talk about your specific situation. So I'm always happy to make time with students to do that. I think we're just about approaching another comfort level check. So we're going to switch feet here. So you're going to see me do another nice tight foot swaddle. One of my pet peeves is a floppy towel. As a client, when I receive reflexology, I want a hug from the towel on my feet. So she's moving things around now to assess her comfort level. What do you think it is? Our last comfort level check, her arm was an 8 out of 10, and her leg was a 6 out of 10. She's pretty happy because right now her arm is a 4 out of 10 and the leg is down from 5. Remember that when she came in, it was a 20 out of 10, so very unbearable. Getting much lower now, but we're not done yet. Do you think it's going to go lower? It's time to give the other foot a little reflexology love. As much as I would love to keep working kind of aggressively on those specific symptoms she has, I want to give her that almost a full reflexology experience. Like I said, this is one of those sessions where I really do skip a lot of reflexology points because we are working within the specific needs and desires of this client. A very unique session for her needs. So you'll see me doing the relaxation sequence again. Another reason why it's nice to move over and work on this other side of her body so we can get her nervous system really relaxed. So even though her symptoms are affecting her right side specifically, working on the left foot can still decrease her symptoms of pain. So it'll be interesting to see in her next comfort level check where we're at. That spinal stretch relaxation technique is one of my favorites. I love receiving it. I love doing it. so nice for the experience on the foot, but it's also really enjoyable and beneficial for the nervous system in general. It's a technique that I will use when I'm at births with a client who's exhausted. If they don't have an epidural, but we're getting to that time in a birth situation where maybe an epidural would be beneficial to help with relaxation and the rapidly declining energy levels because they've been going at it for a long time. Instead of an epidural, I will have doula clients who want the reflexology instead, and I can put a client who's in labor to sleep using that spinal stretch technique you saw me doing. So it's another situation where I won't do a full session, but use specific techniques to meet the needs of that specific situation. And I've done the spinal stretch technique on just one foot on a client who's in labor for more than an hour, and then switching to holding their solar plexus point during their contractions, and they can sleep through them. It's lovely. So one of the most relaxing techniques that we can do. Rocking the foot a little while I deliver firm pressure to the solar plexus point. And zoning. I love sitting on the covered ball when I do reflexology. It's very comfortable. It's good for my body. It allows me some movement, but it's quiet. I like the cover on it because it's less likely to roll very far, and it prevents the ball from picking up grit from the floor. Even the cleanest floors will have enough debris on them that it seems like the exercise balls like to pick them up and it sticks to it. And the cover's washable. I can grab the material easily so I can move the ball with one hand to exactly where I want it. But especially for Reiki sessions, I can move that ball around the table to sit down when I want to without causing any noise disruption. So you just watched me doing the zoning technique again, and now I'm covering the points for the pituitary gland and now the hypothalamus on the big toe, the master gland of the body. And I like to call the hypothalamus the pituitary gland's bouncer, because everything from the endocrine system and the nervous system that's communicating with the pituitary gland has to go through the hypothalamus first. It's like the doorman. And working firmly on the spine again. So even though this is on the other foot, we only have one spine. So this work that I'm doing on the left foot is still going to benefit what she experiences in the right side of her body, because the spine is directly center in the body. Being very thorough with the spine by cross-hatching it all the way up into the big toe. And being very thorough with the nervous system by working the toes. For some of your clients who have CRPS, you may also have to provide modifications to your table setup for their comfort level. So sometimes this client likes to have a pillow under her arm to help support it. Sometimes she needs the blankets off of her arm or off of her leg, because even just that little extra weight or touch can trigger discomfort in her body. So always communicating with our clients about what they need to be as comfortable as possible is really important, especially for people who are coming in with chronic pain or nervous system dysfunction specifically. And I like to ask questions in a way that puts them in a position where they have to provide me with information. So if you ask a yes or no question, people pleasers are more likely to just answer with yes, So if I were to say, like, are you comfortable? They might say yes, even if there's something that could make them more comfortable. So sometimes I will ask, like, is there something I could do that would make you more comfortable? Because it does allow for a no, but it gives them an opportunity to ask for something specific. Or I might say, would you like the blankets the way that they are, or could I change them to make you more comfortable? Can I lower this knee pillow for you, or is it comfortable where it is? By asking for specifics, it really does invite them to tell you exactly what they need, without feeling like a burden, because that's a common feeling for people who are dealing with chronic pain. They're used to sacrificing themselves because it gets tiring always asking for people to accommodate you, for a lot of people who suffer. I don't like when any of my clients leave their session and having focused the whole time on something that was annoying that I didn't know about. And so it could be that the table is too hard, or the cushions weren't placed properly, or the pillow was annoying. So I also encourage our students and alumni to spend a lot of time on their own table as well. It's a huge part of the experience. The music should also be thoughtful, not putting just anything on. You should really enjoy the music. And or you can ask clients if they want different music. I like the music to be very soft and relaxing, because that can help the nervous system to calm and relax as well. So nothing too stimulating. We want our clients to have a full experience. It's not just about the pressure that we apply to their feet. You can see here I'm working on that adrenal gland point again, the lymphatics. So a lot of nervous system support in this session, a lot of support for relaxation and stress, the lymphatic system. Ideally, we would work on the elimination system as well, the intestines and all of that. And she does get that in some of her sessions, but not on a day where she comes in with 20 out of 10 pain, unfortunately. We really want her to leave feeling as comfortable as possible. And other weeks where she is more comfortable, then we can focus on some of those other body systems, which will help her body to be as healthy as possible. And we're just a couple minutes away from our next comfort level check again. So we haven't even worked on the right side of her body specifically since our last comfort level check. So when we left the right foot to start working on the left foot, her arm was a 4 out of 10 and her leg was a 5 out of 10. So we'll see in a moment if any of this reflexology work that we've done on her left foot has changed her comfort level at all in the right side of her body. What do you think? Do you think it's going to be the same, or do you think we will have further decrease in her pain? back to one of my favorites, the spinal stretch technique. So let's wipe off that excess oil. This is also one of my pet peeves, is leaving oil, especially on the bottom of the foot. I do not like to walk around with oil on my foot, and I, as a reflexologist, don't want oil on my carpets or floors. So a good firm wipe, nice towel swaddle, covering things up. So that is the conclusion of the reflexology part of her session. We are still going to do Reiki. I will probably speed up a lot of the Reiki session because there's a lot less going on. Washing my hands. I'm really lucky in this clinic room where I work to have the sink in the room. It makes combo sessions more fluid, but this is the only place I've ever worked where I have that. So I'm starting the Reiki session now. I took the wedge pillow out from under her upper body to lie her flat. So she has the pillow under her head, a thick pillow under her knees still, and the flatter pillow under her feet. And so I'm starting the Reiki session at her head, which I like to start almost all of my Reiki sessions at the head to really focus on that mental and emotional relaxation, to get the mind to calm and quiet. So we did do a comfort check before we switched from reflexology to Reiki, and I haven't forgotten. Her arm, remember when she came in, was a 12 out of 10. At the end of the reflexology portion of her session, that 12 reduced to 2 out of 10. So it was a 4 out of 10 when we finished her right foot, and just by working on her left foot, it came down even more to 2 out of 10. 2 out of 10 is amazing for her. She's very happy if she can leave her sessions experiencing a 2 out of 10 pain. There are days where we get her all the way down, but it really depends on her comfort level when she came in, when the last time she had a medical treatment was, and things like that. Her leg pain was a 20 out of 10 when she came in. When we finished reflexology on her right foot, it was a 5 out of 10. And now, at the beginning of our Reiki session, her pain level was a 2 out of 10 in her leg. So we went from 20 down to 2. What a gift. And you'll hear her talking about her pain level and how she feels about it. I'm pretty happy with that. But you'll hear her talk about it at the end of this video. There are times where the Reiki also, it normally further decreases her pain. So we'll see if that's the case today by the end of her Reiki session. And another session that she really enjoys is hypnosis. And there are hypnosis techniques specifically for pain reduction, which is fascinating. So I'm not covering that in this video, but I will tell you the mind is very powerful. Hypnosis is also something I highly recommend for people who are dealing with CRPS, but we'll save that maybe for another video so that you can see just how amazing the mind is at reducing a person's experience of pain. Reiki is especially beneficial for people who are dealing with nervous system dysfunction, trauma. All of those things are benefited by Reiki because Reiki calms the nervous system. What people experience during a Reiki session is a theta brainwave state. And they'll often describe that as feeling like I was asleep. It was like I was asleep, is what they'll say, but I wasn't asleep. So the body goes to sleep, but the mind still has awareness of where one is. So we don't lose that total consciousness. And you can enter a dreamlike state while still having awareness of being in this room experiencing Reiki. It's one of my favorite states to be in, and It's actually quite hard to induce a theta state using very many other techniques. So, in hypnosis, people can experience a theta brainwave state. You experience theta naturally immediately after you wake up and just before you fall asleep each night. Sometimes you'll remember being in that theta state. And it's the way that I just described it, where you know that you were almost asleep. It's like, oh, I was starting to fall asleep, but sometimes you pop back out of it and come back into a waking state. Most nights and most mornings, people don't remember their theta brainwave state, but it's a very healing state for the body to be in. Delta is the sleep brainwave state. So theta happens first. And when we're in theta, we can easily tap into our subconscious mind. So the mind is really open to any suggestions that we receive, which is why hypnosis can be so powerful and effective. By relaxing somebody into that theta state, what we say to them goes right into the subconscious mind. It bypasses the conscious mind. So not during this session, but there are other sessions that this client has come to where we've hypnotized her into that theta state and then convinced her subconscious mind that her pain no longer exists. And that lasts her for a period of time where she experiences an anesthetic effect without the side effects of or risks of medication. So that's quite amazing. But Reiki also induces that theta state. And what's happening to the nervous system when one receives Reiki is that it goes into a parasympathetic state. And you're going to hear the client actually talk about that a little bit at the end of this session. So when you're in pain, your nervous system's in a sympathetic state, which is also known as fight or flight, or people also will say they go into a freeze state when the sympathetic nervous system is engaged. When you're in a sympathetic nervous system state, that fight or flight or fight or freeze, the body is not going to prioritize healing. You experience tension in the body. The hormones that circulate in the body are about survival. So there's more of the stress hormones, more cortisol and things like that. And so digestion is affected in a negative way. Delivery of nutrients to the cells for proper function and healing is not a priority when we're in fight or flight. But the unfortunate reality is that when people are living their day-to-day life in fight or flight, there's not actually an outside threat. So you can be in your own house, on your couch, trying to relax, but the body's in pain, and so it stays in that fight or flight, and so healing can't happen. So when we do reflexology, it induces the parasympathetic state. It relaxes the nervous system. When we do Reiki, it induces the parasympathetic state, relaxing the nervous system. The body feels safe. You can see the relaxation in this client, although I've kept her mostly not visible for her confidentiality, her privacy, but you're seeing her body is not moving. She's not fidgeting. She's not adjusting her position. And for somebody who lives in chronic pain, that is rare. As you know, if you have experienced even low levels of pain, it has you shifting or adjusting yourself, trying to get comfort. But her nervous system, for the duration of this visit and after it, is in a healing state. The parasympathetic state is rest and heal, or rest and digest. So the body is now prioritizing healing. It's looking at the areas of the body that have experienced injury or are not quite in balance, and it's looking at those areas of the body and prioritizing bringing them back into balance. So the more someone experiences that parasympathetic state, the more so for example, if they book reflexology and or Reiki sessions regularly, they're giving a gift to their body in that it can dedicate more time to healing. So it's not just about feeling more comfortable. That may be the motivation for coming, but it's about giving the body a break so it can maintain greater levels of health, so that the immune system can function better, so that the digestive system can function better, so that the cells and tissues of the body can receive more of the nutrients that they need and eliminate more of the waste that they don't need more efficiently, so that everything is healthier. I spend a lot of time at the head of my Reiki clients, almost all of my Reiki clients, because I really do find that it is the area that induces the greatest relaxation. So by starting there, it's almost like I can get my clients out of their head a little bit. So my next priority with this client is her right arm. And so you can't see my hand position from this angle, but I will be changing the angle of the camera shortly. And so my left hand is on her shoulder and my right hand's actually hovering. I try not to touch that right arm directly, which is another reason why Reiki is so wonderful for people who have CRPS, because we can deliver the modality and the benefits of the modality without touching the body if that's what is needed. I like to do hands-on Reiki whenever possible. So when I was working at her head, my hands were on her head. But now that I'm on her right arm, offering Reiki to that area specifically, I'm hovering with at least one of my hands so as not to trigger the nervous system. But the benefits of Reiki do not decrease with that hovering. There you can see my hand up off of the body in this position. I'm almost certainly using the distance symbol while I'm working on this area of the body as well. So a lot of focus while I was on the head would have been a lot of the emotional mental symbol from Reiki. And when I work on the area that experienced the trauma, because the trauma occurred in the past, I like to also use the distance symbol so that the client receives Reiki in the past, at the time that the trauma occurred. So we're dealing with the current symptoms, which occur in the present, but we're also offering Reiki for the specific trauma. So I moved the angle of the camera so that you could see not just my hand position, but one of the things that also happens when I'm working with this specific client, when I'm working, whether I'm doing reflexology or Reiki or hypnosis, she keeps that arm pretty guarded. She holds it up. Some days we prop it on a pillow if that's what is needed, but it usually stays in somewhat of a tense position. So one of the things I started noticing before I moved to the camera was the arm was starting to drop. And there are some sessions where it drops a lot. So we may have missed a lot of the drop before I moved to the camera, but as it starts to relax, as her nervous system is relaxing, as her comfort level is increasing, we see that arm letting go as well, which is actually a really good sign that the Reiki is helping to increase her relaxation. So during this session, it was little tiny slides that were happening just a little bit at a time, but a positive sign that I was really happy to see. I'm keeping that left hand at her shoulder, but then I've switched positions, working over her right hand, working over her right elbow, just to give thorough coverage from the Reiki energy to the whole arm. We will be, at the end of this session, checking in with her again. We're not doing a full 1 hour Reiki session, so when I do a combo with her It's 1 hour of reflexology, sometimes a little more, and half an hour of Reiki. So we will be talking to her at the end of the session to hear from her about how this session benefits her and what she wants you to know about using these modalities for CRPS specifically. It's so nice to see someone who deals with chronic pain experience this deep level of relaxation. She hasn't budged. And part of that is because she's already received reflexology, so her nervous system was already very relaxed and her comfort level was already significantly higher than when she came in. So just sweeping the energy of that arm before switching sides. Working on the left side of the body now to give her balance in her body. So like I said, while her symptoms mostly, well, they do exclusively affect the right side of her body, we want her whole body to get the benefits of the session and the relaxation. We don't want her feeling lopsided in her body. And so I'm going to speed up this portion of the video so that we can get to what you're all waiting for, which is her testimonial at the end. But I do stay on that left arm, and you will see some other positions that I will be working on during this reflexology and Reiki combo session. So I'm not cutting out the rest of the session. I'm just speeding it up a little bit. So you're going to see it twice as fast as it happens. The duration of the Reiki session that we did during this visit was a half hour in total. And so we're approaching the end of the Reiki session, but you can see I'm back to hands on the body now, working on those lower chakras of the body. I think what I want people to realize when they're thinking about Reiki for CRPS is the tremendous benefit to one's emotional and mental state. I know from working with clients who live with chronic pain that that's one of the greatest struggles is the emotional well-being. It's very hard to function, to experience happiness, to experience joy when there's always pain happening in the background. It almost doesn't matter what you might be experiencing in life. You could be going through some amazing experiences with family or with friends, some things that should be evoking feelings of gratitude or joy, but it's just so hard to enjoy everyday life or even the happiest moments of life when also dealing with pain. Pain is a thief of joy and happiness, and I know that. And while Reiki can have amazing benefits for the nervous system, which is going to help somebody who's dealing with pain, it also, and the relaxation induces healing, and so that's going to help with the physical symptoms. But one of my favorite benefits of Reiki is the effect it has on one's mental well-being. I love receiving Reiki or giving Reiki for depression or for anxiety. People always leave their Reiki sessions saying, I feel so much lighter. And lighter is what one wants to experience when they're living with chronic pain. Leaving feeling lighter is a gift, and it's one that I get a lot of fulfillment out of offering people. So whether one's experience of pain is mental, physical, or both, I love Reiki for pain. I love that it gives people feelings of peace and calm and clarity and happiness. If somebody came to me and said, Michelle, I'm experiencing depression, what modality should I choose if I could only choose one? I personally would choose Reiki. That's my bias too, because of my own personal experience as a client. Reiki always brought me back to light at times when it was feeling really heavy or really dark. So you can tell I'm approaching the end of my session because I'm working on her feet. I end most of my sessions at the feet, get people grounded again, while her reflexology session was very grounding in itself. The Reiki is very lightening, but I also want them to feel that physical presence in their body, which is not something most people who live with chronic pain would ask for. They're often looking for an escape from their body, but our intention is that this body feels safe and comfortable again and like a desirable place to be. So we're going to find out very soon. The session is almost over. It's not obvious that this has been sped up, but right now the speed of the video is twice as fast as it happened in reality. And so we're closing the session, sealing the healing that we've done. And I'm clearing my energy field the way I do. I'm detaching myself from my attachment to outcomes, giving gratitude for the healing, for the abundance, for the client. And you're going to hear now what she thinks of the session she just received. So when you came in today, between 1 and 10, if we were to measure your emotional and mental state, with 10 being really low and 1 being very high, like pleasant, where would you have said you were before you came in?
Easy 9, 10. My pain levels were really bad this week.
And then your pain in your arm when you came in, if we were to measure that on a scale when you came in between 1 and 10, with 10 being very uncomfortable and 1 being comfortable, where were you?
It was a 12.
And your leg?
Oh, it was like a 20, which seems hard to believe, but it was.
And so now that you've had your reflexology and Reiki, the combo session, if we were to measure your emotional and mental state now, with 10 being really unpleasant and 1 being pleasant, how would you say you feel emotionally?
At least 2.
That's wonderful.
It's such a lightening of my load, and it's relaxing. I feel comfortable in my body, which I don't normally do.
Awesome.
Yeah.
And your comfort level in your arm, you said it was a 12 when you came in.
I know, it's amazing. Like, I can actually move it without it aching, and I would say it's like a 2.
And your leg was a 20 when you came in.
It's a 2 too.
That's awesome.
Like, my knee was really sore, like, for doing stairs.
And we've done this before. You're a regular, and these are the kinds of results that are pretty common for your visits. How long does it generally last for you?
Because my pain condition can be ruled by weather. It depends on weather, but I'm good for at least 24 hours, I would say.
So you get a day that's you get a break.
Yeah.
Nice.
And it's life-changing, actually, because it's so heavy being in pain all the time. It's a nice break.
Amazing. Is there anything else that you would want, somebody else dealing with CRPS to know about reflexology and Reiki?
And just what I've learned from you, it's about your sympathetic, your parasympathetic system, and it is our nervous system that is majorly affected. Just to get a break, no matter how long it lasts, even if it just lasts for the time in this room, just try it, just try it.
Yeah.
I've tried almost everything, and this is awesome.
Wonderful. Well, I'm glad you came in, and thanks for allowing me to share your experience with other people.
Thank you.